everybody. We are at episode 200. We're calling it Ambient AI's Real Wins, Cybersecurity's Quiet Losses, and Healthcare's Double Standards. And in our style, we have a second title, What the Pitt season finale tells us about where we are and where we are heading. Now,
yes, and Megan made me watch the show. Everyone needs to know that.
I did. And so, spoiler alert, we are talking about season 1, season 2, and the Pitt season finale. So if you watched it, you know they talked a lot about various things in healthcare, impossible standards, quiet wins that nobody celebrates, double standards, a whole staff crying on the roof for reasons they can't really name.
Right.
Well, I'm Megan Antonelli, CEO of Health Impact Live, and this is Digital Health Talks. We launched the show in July of 2020, 5.5 years ago. And 200 episodes in, one question still running through it all. Is technology actually fixing healthcare or just optimizing what already exists? No guest today, just me and Janae Sharp, founder of the Sharp Index, using the Pitt finale as the mirror and asking what it actually reflects back at digital health right now.
Right. I'm really looking forward to it too, because so many physicians identify this as the show that's the most accurate. Obviously, Hollywood is Hollywood, medicine is medicine, right? But if everyone's like, this one isn't as bad, that's high praise from people in medicine. Also, they partner with the Dr. Lorna Breen Heroes Foundation, Debriefing the Front Lines, lots of organizations that care NAMI about mental health and about making things better in healthcare. So seeing some of those big themes, including IT, be on the stage, in the main stage, in entertainment, it's amazing. Imagine a medical drama that wasn't inaccurate all the time.
Right. Absolutely.
Amazing.
And it is. And, for me, Noah Wiley is enough. That could have stopped there.
Yes.
But to actually see our, the work that we do reflected back in a show, is a lot of fun to watch, although it sometimes can be infuriating. And it certainly does point out some glaring, problems in the healthcare system, but also inaccuracies in their telling the story a bit. So let's get into it. I think, I can't believe it's our 200th episode. I can't believe we've been doing this for as long as we have. And it is so much fun. So what we're going to do is we're going to take some of the big themes and some of our favorite parts of the Pitt, and then talk about our 5 favorite episodes. So we're still going to do our 5 good things, because 5 good things is our favorite thing about digital.
It's true. I really like thinking about the things that are going well. And I also like that we can look back and kind of see the progress that we've made both on our podcast and in healthcare. Mm-hmm. So what are we starting out with?
Well, and one of the things that we talk about pretty consistently in healthcare, both in how leadership is represented within health IT and healthcare, but also in how we care for patients in terms of equity and access. So I think the sort of latest storyline within the Pitt around al-Hashimi's seizures, and Robbie sort of totally failing to kind of address those correctly or appropriately. I mean, obviously there's many ways you could address it, but I think the double standard of how he dealt with Landon's addiction problem versus how he's handling al-Hashimi reflects both his weaknesses as a leader, but also some gross inequities within the system.
Right. And that's one thing that was interesting, because it felt unrealistic. Like, if you have someone who has an addiction problem and is stealing from the hospital, let me tell you, that's not going to happen, even if they're a charming actor.
Yeah, it's pretty cute.
Like, it really felt a lot like legal maybe should have stepped in to the episode and helped him. But,
Yeah, and they glossed over what might have happened, right? I mean,
yeah.
We don't really know the full story behind how he was put on leave or anything, but there is definitely a double standard, and we're only beginning to see what's going to happen with al-Hashimi Al-Hashimi, but we do see what Dr. Robbie, what his reaction was, and his reaction to a friend, a mentee, versus someone who was going to replace him for a few months was very different. And
I also responded really strongly to that portion of it, just because we've helped women, and also it was really relatable for someone who seems a little unhinged and is in charge to just be sharing their pain with the people they work with. And it will not be a safe work environment when you're working with a boss who is not stable. Like, it's going to be a nightmare. It's going to be arbitrarily a nightmare.
He speaks from experience.
Like, I speak from physicians that we've talked to and helped also, that was realistic, and it felt realistic. Like, everyone's worked with someone who was a little off, and being able to identify what to do with that is difficult. It also reminded me of, I think, the episode with Chris Gibbons, who is well-spoken and not a little off, but able to have that insight about what's going on. That's so important.
Right. Well, and I mean, I think, and Chris is so passionate about equity in how healthcare is delivered and access. But, the other thing that sort of ties in Chris's work is around AI. And of course, that was how we got introduced to Al-Hashimi. On Reddit, they call her the AI doc, right? There, she's coming in and saying, use these tools. They will make you more efficient. They will help with burnout. And of course, that theme speaks to us. So
the passionate younger doctor who has great ideas about technology. I love those doctors.
Yes. And I think that we see a lot go through that episode around the AI adoption. The scribing and putting their records in is a huge part of the episode, of course, because of the third piece of it, which is the cybersecurity threat that happens that forces them to shut down the entire health system. So, between the AI, the ambient listening, the importance of it, watching them, the residents and doctors literally falling asleep at the computer screen multiple times for Dr. Santos's case, while they are trying to use these new tools. And then, in fact, I think, to speak about what Chris talked about in that episode, which was hallucinations, there is an episode last season where they come down and they say, why does it say this? This doesn't make sense. And it was, in fact, the ambient tool mishearing and the doctor not catching it. So,
and we love our ambient tools. So if you want to see that episode, it's Navigating the Intersection of Equity and Innovation in AI-Driven Healthcare with Chris Gibbons. He's now the entrepreneur in residence at Johns Hopkins University Bloomberg Center. And he's brilliant. He's been a guest of ours and spoken many times. So
literally one of my favorite people in person and on the show, hands down.
Yeah. So he's one of our point number one favorite things altogether, always involves him.
Yeah. And then on AI, one of my favorite shows that we just did recently, and it was a thrill to have her on the show because she used to be with New York Presbyterian, my home hospital. She is now at Sutter, Ashley Beasy, who talks about sort of that pilot to platform scaling AI across and what Sutter has done, and how it's created so much efficiency. So, great episodes and great conversations around that. And definitely one of my favorites. So,
yeah. So it's Dr. Ashley. Is it Dr. Ashley Beasy?
Yeah.
Is that how to say her name? Yeah. Chief AI Officer of Sutter Health. So check those episodes out. And now let's talk more about AI.
Well, I think that, the ambient listening piece goes, sort of cuts through the whole episode and where it then falls down, right? Because they ultimately lose all technology in the show to that threat.
I think all of our listeners can relate to that. At some point in their career, either they've started a rollout, they've had 2,000 tickets, or their system has gone down. So paper charting. And
I think the best line in the whole season may very well be the nurse who comes back, or the administrative charge nurse who comes back to help them through this paper running system, who says, I was downsized to digital transformation. So not only do we have the double burn of this cybersecurity threat and knowing what that feels like if the systems go down within the health system, but also knowing that we've seen some folks, sort of go to that. So not every episode basically had brought all of those messages home for sure. I think
that was so relatable. I think too, like
yeah,
who comes in an emergency? The nurse who knew her stuff.
Yeah, right, and she did, for sure. I think that I loved how they rolled in a fax machine as though the fax machines weren't already there. So there's some key moments where they play into this new, kind of level of tech. But then,
was that like an Easter egg though for people for discussions about the fax? I feel like it might have been. People are like, imagine.
Right. Well, speaking of Easter eggs, what about at the very, very end of this episode? And there's a badge stolen, and we see it on one of the patients who is out in the street now with I'm going to forget his name, but his badge. So cybersecurity all the way to identity management. So let's not forget about our episodes with our partners, SailPoint, and what they do and how important that is. But, they really, I think one thing is they really touch on just about everything in terms of, the challenges, and to think it's only been 2 shifts that they've managed to stuff that all into 2 seasons. But
that's unrealistic, but let's,
yes, well, I hope it's unrealistic, but
unless someone out there, ER doctors, weigh in. Have you had a shift like this? In the comments, we want to hear about it, and we want to have you on our podcast talking about it.
Yes. So I think one of my favorite episodes is with Rob Seabog. And, while this one, it goes back a bit, we talked a lot about the Change Healthcare breach and redefining healthcare cybersecurity, back, it was all of 2025 that we did that. But the story and what he had to say is still so relevant today. And none of that has become less relevant as, AI adoption and the threats kind of continue. So that's definitely one of my favorite episodes, and he's one of my favorite folks to talk to. So, I think
it's so important too, because one of the things when they talk about security and identity breaches, a lot of times the conversation is so practical. Like, we're trying to get a job done. Is the technology allowing us to do it? And I think about that too, because one of the things we've done with Sharp Index, we looked at people's behavior. And one of the first things you always realize is that people are logging in under everybody's login. Like, we are at the baseline sometimes. Mm-hmm. So these conversations from several years ago apply today.
100%. Yeah. No, and as much as we're adopting technology fast, things are moving faster than I think they've ever moved before. The problems are still there, and we are still figuring out, how this technology can really fix some of the fundamental problems. And of course, that's what I love about the show, is that it really is bringing to light, maybe in somewhat of an unrealistic way, all of the problems. And unlike other, hospital shows, which tend to lean towards patient drama and relationship drama between the physicians, because, back in the soap opera days of romance, that's what we like to watch, right? I mean,
these are the days of our lives. We still love Lisa Rinna, and we're still here for that.
I mean, let's talk about the first hospital show, General Hospital.
I never watched it, but I'm just not a hospital show watcher.
And then we had ER and Grey's and House and Scrubs and all the rest. And I watched them pretty much all. And, this one is different because of the way it's talking about the relationship between the physician and the health system. Now, that being said, there are patients every episode, and a lot of those stories are also saying something, right? I mean, I think there's been, and I'm sure I'm conflating seasons, but, patients.
They're all one season to us.
Right. Patients coming in, kids with stuff up their nose, parents who don't want to vaccinate their kids, and you see the physicians making judgment calls, but always providing the best care to their ability. Right.
And I've seen those comments online. Physicians are like, well, if you don't want a vaccine, why do you want treatment for measles? Like, people are saying this.
And of
not
course,
just on Reddit.
Right.
This is on Threads. This is, Facebook. People are frustrated. And I'm glad that the show captured some of that frustration and also opened up the dialogue, because people are mad. People are frustrated with the health system. They don't believe what doctors are telling them. Violence against healthcare providers has increased. It's one of the most dangerous places to work, right?
And of course, that's a theme that comes through.
They had to talk about it, and they have to talk about patients.
Mm-hmm. And I think where we have, the first season, the big event was the mass shooting at the concert. The second season, it's 4th of July, which is a whole other issue. People are coming in drunk and having, prepared margaritas and have blown off hands and limbs. So there is a consistent, sort of theme of sort of self inflicted injury that happens. And then to juxtapose to that, there is the very touching story about the mom with cancer who, really chooses to spend her last hours in the ER to kind of alleviate the burden of her husband, who has been her caregiver. So they really do.
That's heartbreaking.
Right. And it was heartbreaking. And of course, you're watching the physicians go through all of that, all within a 12-hour, 16-hour period. And I think it does it. Some things fall flat. I think and some things are really well done. The woman who comes in who didn't want medical care and she's got preeclampsia and almost dies. I mean, that of course juxtaposed to baby Jane Doe, who's been sitting in a room mostly all day, with an occasional occasional physician taking care of them. But and then on top of all that, I mean, this is, a patient dies in the waiting room. And ironically, almost the last, sort of not the least of the stories that happened in the season was that one. And, I'd like to think that would be a bigger deal on any day, on any given day. But there is a patient, they're judging the patients, they're dealing with that. And it goes back to our very early conversations with Dean around moral injury as a physician and what that means. And of course, expecting to be taking care of people and doing good healthcare, and in the ER, it tends to be a larger gamut of things that they're grappling with. I
do think one of the things about the show that I understand it's a show. You need drama. People need drama. That's not all going to happen in one day. One thing I remember clearly from talking to a physician is her saying, the biggest misconception I had about emergency medicine is that we were going to be doing emergency medicine, is that everything we would do would matter. We'd always be saving lives. And that day to day is tough. And so the Pitt takes on this topic of emergency medicine. They're condensing it all down, I think, because they have to. I mean, it's TV. No one wants to watch 800 cold cases, right? But burnout for emergency medicine physicians, right? If Noah Wiley was in it, Megan would be there. And when Noah Wiley comes to our podcast, I can't imagine what you're going to say. But burnout rates for these physicians is high 50s to low 60s. They're burned out. So I'm glad that they looked at some of those things and those important topics. Although it was kind of, I could see that being really relatable, but I can also see emergency physicians being like, really? You had to only do the drama, didn't you?
Right. It is almost like they have a checklist of, what messages do they want to send home today? Right. But of course, the biggest theme that has run from the very first episode all the way to the last episode is, sort of Noah Wiley and Dr. Robbie's, managing his PTSD from the pandemic. Sort of that first episode where he's up on the roof, where that his colleague is there trying to help him, through that. There's the therapist or the hospital psychiatrist who's trying to get him to talk to him, and he refuses to talk. And of course, this whole season, he's going out on his motorcycle death trip, without a helmet on and being reckless and irresponsible. Insane. And, as we were all kind of looking at Reddit and wondering, okay, what is the season finale going to bring? There was all this speculation around, obviously Noah Wiley is not going to kill himself or commit suicide because it's his show and he's the star. And so what is that, and there was speculation that it would be Dr. Santos or Landon or others, because they are all going through it. His is a direct PTSD, but then of course they introduced, he was abandoned and he has abandonment issues, and there's a lot to it. But one of the reasons I did want to force you to watch the show is because this is something we talk about so often, and your career and your, organization is smack there in the middle doing the work to help physicians with suicide. So in that, what'd you think of it?
We even talked about that. I remember 2 weeks ago, I talked to someone like, what are the signs, with a coworker? Like, what can you do? And that was one thing that I thought people needed to pay attention to. The person who was able to relate to him was someone who went through it. It wasn't necessarily like the soft social worker. It wasn't the system, because a lot of the times you can't trust the system. They have, they might not feel safe saying that. They might not even recognize it in themselves. I also thought it also showed, even these discussions about people speculating on what would happen, it showed our need for this to be over. Like, you can have PTSD, you can have burnout, but we need it to either go or go away. And that was tough to see.
Right.
When you're dealing with difficult situations or people who have problems, they don't just go away. And I was glad they didn't make it just go away. Right. And that feeling, though, that people have, that like, oh, like this is still a void, I think that's also important to look at, that we're looking for security, and it makes it really tough for us as individuals to see.
Right. Yeah. I mean, there was a lot of people who were very disappointed with the finale, because to some extent, nothing really happened. There was no closure whatsoever. We don't even know if he goes away or not, right? We don't know if he goes on a sabbatical. We don't know if he takes the time. We don't know if he adopts baby Jane Doe, although it's implied, and all of the physicians and residents are upstairs, watching the fireworks, and then go down and sing karaoke, which, is actually somewhat realistic, right? I mean, life goes on, and that I think was poignant, and they didn't do it for the drama, because that is not what the fans were looking for, right? The fans were looking for some emotional climax in that final. Right. And what they got were a lot of friends, a lot of coworkers reaching out to Dr. Robbie saying, what's going on? Don't go. We love you. Come back, Right. And so, I think there's a lot, and who knows where it will go from here. And I think
who knows if that man will steal that baby or not.
But I think
so tell us, what do you think? Will he take the baby?
Oh, he's taking the baby.
We'll teach him how to swaddle.
Somebody's going to teach him how to swaddle, because that was if that was either a window into his actual parenting, or it was some sort of Easter egg signal that he's really. I don't
know. I feel like when I had babies, those hospital workers could really swaddle. They're really good on the swaddle. Yeah, it had to be on purpose. They're like, oh, you didn't have kids. Don't swaddle that baby so well.
Right. I hope so, because my mom, Noah Wiley, knows how to swaddle.
Yeah. Baby. Are they going to get rid of the Ambient AI system? Are they going to have another security breach? Like, where from here?
Where from here is a good question. That will have to be our next episode. But I think, you know, I think what it brings down to us is, you know, we're covering the topics. We are. Maybe we're trying to do too much. They try to do too much. They pack a lot into each.
When someone tells you they're too much, tell them to go find less.
But
we are not too much. Okay.
It is, you know, it's an exciting and interesting time, and the reality of healthcare is enough drama to certainly fill 2 seasons. We'll see what they do with the 3rd.
Yeah, and let's also see. What I love is that they're partnering with nonprofit organizations. So for those of you watching, when you're having those big feelings, support the organizations behind it. We know that emotion drives behavior. So it isn't going to be us realizing that things are hard that can help improve mental health. It will be things that drive our emotions and make us realize, oh, we can do something about this. And even the Pitt, they're not going to fund all of the things that need to happen. They're not going to fund the research. You know, I think they're going to make some money, but let's make sure that the things that are happening are also helping and leading us to be better. You know, if you're a leader and you realize, oh, I should be having more conversations about these topics that are literally so ubiquitous that they came up on the Pitt, it'd be a good idea to have those conversations.
Yeah, 100%. And I think that it's what we learn here doing the work that we do. And it is what all of our listeners and the folks who come to our events do is, you know, the shift isn't over. It continues. The work will always be there to kind of improve healthcare for everyone. And it's an honor to do it with you, Janae, and to have been doing these 200 episodes. And we have to give a shout out to our team. And of course, Shahid Shah, who has, you know, it was actually Shahid's absolute idea to turn our work into a podcast 5 years ago. So shout out to Shahid, who's often on the show, and Andrea also, who does all of our editing and production. We couldn't do it without everybody. So thank you so much for listening. You know, I highly recommend going back. It was so fun to look back at some of the episodes from the last 5 years. You know, most are still incredibly relevant. And, you know, we've got great leaders on, and now I want to get a lot of them back. So thanks again. Subscribe if you are not already. Subscribe to Digital Health Talks. Follow us on YouTube. And I hope to see you soon at an in-person Health Impact Live. This is Megan Antonelli, CEO of Health Impact Live, and
Janae Sharp, founder of Sharp Index.
And this is Digital Health Talks. Let's keep fixing healthcare one conversation at a time.